Hello and welcome to another video production of Polestar Pilates. Today we've put together some unique clips and interviews with physical therapists as well as Parkinson's disease patients. I think that you'll find it very interesting, as I have, and motivating to know as a physical therapist, and in particular a Pilates certified teacher, how you can implement the two of them together to provide a successful program in your center.
I think the most significant benefit to them is probably the improvement in their balance. I have seen numerous people come in and start the program, and they would come in wheelchairs and many with walkers and such. And now I find them either walking independently or with a cane, but their mobility is certainly improved, and they feel as though they have better balance, and they're not in fear of falling to the degree that they were before they started the program.
The most significant benefit that I've found with patients with Parkinson's disease using Pilates is really that their balance is much improved, and I'm also going to say their quality of life, because the way that they feel, their level of wellness when they come in and then when they leave is such a heightened level, and it's very hard to measure, but I really feel that their quality of life is greatly enhanced by Pilates.
The most significant benefit that I've noticed for the patients is just the general movement that we have them do. Not only gets them physically more able to do things, but it also lifts their spirits, I think. And having them be able to do these simple tasks, which before they may not have been able to do, and I think it's really affecting their everyday life.
I feel more positive, more active. I feel wonderful.
My overall endurance and fitness, and I feel better, after the exercise helps me feel better.
The greatest challenge in treating patients with Parkinson's disease with Pilates is really being safe. I mean, there are so many people, and there's also so many different levels. So with the disease progression, there's so many different levels. You could have someone who's ambulatory, and then you could have another who's not ambulatory. So really working in a circuit environment with so many different pieces of equipment and having it safe and be able to treat each patient with the exercise and have it applicable for all patients.
One of the biggest challenges I've noticed for the Parkinson's patients is that their muscles don't always have the memory of the movements. It's pretty often that we have to re-show them the Pilates movements and the exercises, and once they get it, they sort of start to get the hang of the exercises and can continue on with it themselves. And one of the other challenges I've noticed too is you kind of just have to keep a close eye on Parkinson's patients when they're in the gym, just because of their balance issues and their slow gait. So you have to watch out and make sure everybody's always safe.
Pilates tends to be a very precise movement discipline, and the Parkinson's patient tends to have a lot of difficulty with control and with balance and that sort of thing. So we're continually trying to get them to move in these more precise patterns and that sort of thing, and kind of retrain as much as we can within the limits of the disease. But we just find ourselves needing to kind of let go of some of the traditional rules of Pilates, and trying to just get them into movement and trying to keep them as precise as they can be. And and we've just found that has been extremely beneficial for them.
The workout it gives me a good exercise workout without really exhausting me.
Working with Parkinson's patients, I've learned a lot about the disease process itself. I knew a general basis before, but I didn't realize that they can have so many different symptoms according to the person. Someone may come in with tremor, someone else may come in with stiffness, and that just getting them moving and the movement in general with Pilates can change so much just in the course of one treatment. They can come in one way and walk out a totally different person. So it's been really interesting to see how Pilates can affect the Parkinson's symptoms in general.
In working with patients with Parkinson's disease using Pilates, I found that there's so many applications that Pilates can relate to, like trunk rotation, balance, gait. So it's very beneficial in that there's so many ways that we can target their specific needs with Pilates.
I think I've learned that each individual has varying impairments that are all very classic to Parkinson's disease, but each person showing different sets of these impairments. So each person needs a different type of exercise protocol in order to address the different issues that they may have.
I think it's better than all the medicine that I'm taking. I've had several other exercises and none of them has ever affected me as good as this one. And the exercise seems to eliminate a lot of that tremor I had. And if you notice, I don't have any trembling of the arm or so forth, and I believe that's the exercise's portion of, giving me credit for whatever I do.
I recommend it. I always recommended Pilates for Parkinson's, for every illness. The people are all, I recommend it for arthritis, because I have arthritis too. But arthritis is wonderful. I have more activities, more fast. My mind more open.
I believe that the best thing for people with Parkinson is Pilates, because that tells you to control yourself. You control your muscle more, and controlling your muscle more, it will help you a lot. I have a lot of experience in helping people with Parkinson, because I've been doing exercises. They first told me that I've been doing exercise for 20 years every day.
The environment that we've created here for this Parkinson's group here at Polestar has been fantastic. We've gotten great feedback. We've gotten a lot of recruitment from the local doctors and support groups and such because of the things that each of them are saying about their successes that they've had here at Polestar.
I think that Polestar is just a wonderful, nurturing environment for all patients, but I've noticed really significant improvements for the patients with Parkinson's disease. It's a very calm environment. It's a place that they enjoy going to, and they feel that they can just work out and be themselves, and I think that makes a big difference when they leave here, that they feel so great.
One other thing that I think is really great for the Parkinson's patients when they come into the circuit class is that they also get to interact with a lot of other Parkinson's patients. And they come in and they have a good time, and it's not all serious Pilates. Occasionally we'll have outbursts of singing, and they just seem to have a really good time interacting with each other and getting a social aspect of dealing with other people with Parkinson's disease as well, kind of as a support.
I hope that you've enjoyed this video clip and the small message that we put together with physical therapists and Parkinson patients alike, and that you'll be able to implement some of this feedback into your successful circuit program for Parkinson's patients. I'm sure that you'll find it as successful as we have, and I look forward to talking to you in the future. This is Dr. Brent Anderson from Polestar Pilates, signing out.